This lecture will discuss how we experience emotion, that is, what happens physiologically and psychologically. Emotions seem fairly straightforward in that almost all of us have intuitions about what it means to experience an emotion and what an emotion is. We will see that what seems simple is actually complex, and that the subjective nature of emotions lead to interesting outcomes. The current lecture will discuss the subjective, physiological, and cognitive components of emotions. We will end with a discussion of the ways that people can regulate or change their moods. Before we get too far into the discussion, it's important to differentiate two related constructs, emotion and mood. These two terms are often used interchangeably. However, for psychologists, they differ in important ways. Where emotions are immediate responses to a specific event in our environment, moods are long-lasting emotional states. Let's take a look at that definition of an emotion as subjective, physiological, and cognitive. We'll take it apart and look at each piece one at a time, starting with the subjective component. How do you know when you're having an emotion? You feel it, right? Often we call our emotions feelings. Now, do we all feel the same thing as other people in response to the same stimuli? I want you to imagine you are in line for a roller coaster. In fact, this roller coaster. You're getting near to the head of the line. Actually, you are now at the front. You're about to be boarded onto the front car of the roller coaster. How do you feel? What emotions are you experiencing? Are you feeling it strongly or weakly? Now, are the people around you all feeling that same emotion or to that same degree? So emotions are subjective, and they vary in extremity from intense to non-existent. Emotions are often classified as either primary or secondary. Primary emotions are driven by evolutionary pressures. We discuss these emotions and the possible adaptive purposes of them in the lecture, How Emotions Are Adaptive. Secondary emotions are those that develop outside of evolutionary pressures and are often in response to learning and feedback from our environment. The next piece of the definition of emotion we will cover is a physiological component. That is, the changes that occur in our bodies in response to the stimuli. Let's go back to how you were feeling about the roller coaster. What changes occurred in your body? Did you feel a little increase in heartbeat, maybe? Maybe a little flush? Did you breathe a little faster? If you answered yes to any of those questions, you are feeling arousal. Arousal is a change in our physiology, often accompanied by changes in our autonomic response, such as sweating, increased heartbeat, dilated pupils. Many emotions are accompanied by arousal: fear, surprise, anger, happiness. Sadness is an odd one in that it is often accompanied by a decrease in arousal. The two most important brain structures for processing emotion are the amygdala and the prefrontal cortex. The amygdala processes the emotional significance of stimuli and generates an immediate emotional and behavioral reaction. The two sides of the prefrontal cortex operate differently. The right hemisphere is associated with negative affect, such as sadness, anger, fear, and the left with positive affect, for example, happiness, excitement, and serenity. The final piece of the definition of emotion is the cognitive component, or the thoughts and beliefs we have about what we are experiencing. Let's go back to the roller coaster one last time. What did you label the emotion you were feeling? If you were feeling your heart race, your palms getting sweaty, and breathing fast, you could have labeled it fear, or excitement, or physical exertion if you had just run to get into line. That is, the physiological signs of the emotions, or in the case of exertion, non-emotion, are the same. You could be feeling identically to the person right behind you in line, and one of you would be feeling fear and one excitement. Interestingly, what this means is that if the stimuli that caused the arousal is not immediately recognizable, or is hidden from us, or we have false expectations, we can pick the wrong cognitive label. That is, we misattribute the cause of the physiological change to something else. Schechter and Singer examined misattribution of emotion in a number of classic studies. In one study, participants were given an injection of epinephrine, or artificial adrenaline. Half of the participants were told that the shot they received was epinephrine, and the other half were told that it was a B12 shot. Participants in both conditions were then exposed to the same stimuli. In the case of one study, they were given a progressively more invasive questionnaire. At the conclusion of the questionnaire, the participants were asked how upset they were. The participants who were in the condition that were told they received the B12 shot reported being more upset. Why? All the participants received the same shot and experienced the same stimuli. What happened was the shot of epinephrine caused a physiological change in all the participants, resulted in flushed skin, sweating, rapid heartbeat. But the participants that were told they were getting epinephrine knew why they felt the way they did. It was due to the shot. Those that were told it was a B12 shot did not have a ready explanation, so they looked to the environment to explain the way they felt. Since the stimuli, the questionnaire, was invasive, they labeled the physiological arousal anger. Other versions of the test, they adapted the stimuli, changed it. For example, in one study, the participants watched a funny video and were asked how funny they thought it was. The participants who were told they received the B12 shot thought it was funnier. So here's a little dating advice from a social psychologist. How could you use the knowledge of misattribution of emotion to your advantage when planning a date? Which of these dates would the two-factor theory of emotion developed by Schachter and Singer predict would result in your date liking you more? Pause the video and think about it for a minute, then come back and check if you are correct. If you said coffees, great job, you're correct. The other dates, while nice and likely to be enjoyed by both you and your date, don't take advantage of misattribution of emotion. What could happen is that the physiological arousal due to drinking the caffeine could result in your date misattributing that physiological arousal to attraction towards you. One of the linked videos this week is titled Love or Lust in Scary Places. It's a discussion of one of the other studies on misattribution of emotion. Be sure you watch it. We'll end this lecture with the discussion of how people can regulate their moods and emotions. Emotions can sometimes be distracting or troublesome. Both positive and negative emotions can influence our behaviors in ways that we would prefer them not to. Think about being very angry. Are you able to concentrate on an important task, perhaps studying for an exam? Therefore, we have developed strategies to regulate our emotions and moods. For example, we can choose which situations to seek out and those to avoid. If you want to be in a good mood, you can go to a funny movie rather than a tragic one. You could also focus on certain aspects of a situation. For example, on a tropical vacation, if it rains the whole time you're there and you can't spend time on the beach, you could focus on the fact that you were able to catch up on your reading and to spend more time with your family. You can also reappraise past events in a more positive light. For example, when I was in the Navy as a hospital corpsman, I was on a 6-month-long ship deployment. Most of the time spent on the ship was pretty boring. There were also some not-so-great experiences. Additionally, there were also some really fun times. If you asked me at the time how much I enjoyed the deployment, I would say not much. Now, years later, when I look back, I think more about the good times, exploring new cultures, meeting new people, and making great friends. I've reappraised it in a much more positive experience. We can also use humor to regulate our mood. Humor helps to decrease stress, which we will see in Chapter 11 has many mental and physical health benefits, including improvements to the immune system and the release of hormones and neurotransmitters that have positive effects, such as increase in heart rate, circulation, blood pressure, and decreases in pain perception. In fact, it has the same physiological changes as exercise, with similar health benefits. One other interesting finding is that the particular facial expressions we make can also influence our emotions. If you smile, you often feel happier. If you pout, you can feel sadder. This occurs even if forced. For example, as you can see here in the photos, I am holding a pencil in my teeth, which is forcing a smile, or above my lip, which is forcing a pout. In a study, participants were assigned to one of these conditions. They then rated cartoons. Those with the pencil in their teeth rated the cartoons as funnier. Let's do a short activity. In a moment, I will start a timer for 30 seconds. Once I say go, your task will be not to think of a white bear. That is, you will try for 30 seconds to avoid any thoughts of a white bear. Let's start. 3, 2, 1, go. So did you think of a white bear? Was it difficult not thinking of the bear? What you were attempting is known as thought suppression. That is, a strategy that people can attempt to avoid a particular emotion. For example, if you'd recently broken up with your significant other, you could attempt not to think about it to avoid feeling sad. However, this is actually quite hard to do, as you saw with the white bear example. It takes cognitive resources to avoid thinking about specific topics. Often what happens is eventually we think of the topic, and we get what is known as the rebound effect. The thought comes even stronger than it normally would. Rumination is the opposite of suppression, in which people focus on specific thoughts or emotions. This strategy also isn't highly effective, as it extends the mood and interferes with other strategies to regulate our emotions.